the part of this question that I really want to highlight is, what purpose does cesarean scar massage serve? Well, here are the highlights. It helps big time with pain. It helps with the scar appearance, including that C-section shelf, and it helps with weakness. And the way it does that is a couple of ways. It improves your posture, and it can really help with your brain connecting with those muscles again, especially after surgery when you just can't control those muscles. They've been cut, there's a lot of pain, and just with the tightness, the brain and muscle connection is reduced. Those are a handful of reasons. There are a lot more, but those are the major ones. So scar massage is one of those things that every single one of my cesarean birth moms learn to do. It is a mandatory part of their rehabilitation, and it's really easy to learn on your own. So let's learn more. Two answers to this question here. First answer is you start on day one, but it's not the direct scar massage with the really deep manipulations. It's actually just superficial desensitization massages, and the purpose of that is to decrease the numbness and just improve your confidence in touching the area. And it looks like this, literally just piano keys. The second answer to this question is you start your direct deeper scar massages after you're discharged by your doctor. And here in Ontario, that's usually around a 6-week mark when you get your checkup. What you're looking for is no infections and to make sure that the whole wound has healed closed. Great job on that daily tapping or the piano keys. Change up the technique so that you're trying different types of textures on your skin. Sharp, dull, soft, a little bit rough. So for example, a baby blanket versus a face cloth versus a loofah sponge in the shower versus even one of those little scrubbies. Your soap versus your hand versus your soft t-shirt versus a prickly wool sweater, that kind of idea. About the scar oils, while I don't teach scar massages with oils, it doesn't mean that you can't use them. I mean, absolutely. Oil is really great as a moisturizer, for example. And after your cesarean surgery, the scar will be itchy. And if you're living in a country that's more dry, like me in Canada, moisturizing is a really great idea. In general, yes, but here's my big question to you. Why do you feel you still need to do scar massage when you're pregnant? Sometimes it's quite obvious that we want to do scar massage because the scar tissue or the fascia is very tight, and as we grow during the pregnancy, we feel like that is a restriction. However, we can't always be sure. So it is always best practice to be assessed in person if possible by a women's health therapist when you're pregnant, because every body is different. The answer to this question is it depends, because it depends on the technique that you're doing. So for example, the technique I said in a few slides before, which is the desensitization piano keys technique, you want to do it very softly. It shouldn't be painful at all. But here is the principle that you want to remember. No matter what technique you're doing, you're always asking yourself two questions. What is my pain and what is my mobility? In this case, your pain for the piano key should be 0 out of 10. That's the appropriate pressure. The mobility that you feel is no different between surgical and non-surgical area, meaning above and below belly button. But if you're doing a technique that looks more like a pressure that's, let's say, small circles, and you're supposed to be dragging the tissue around, it's appropriate to feel like 1 or 2 out of 10 during the technique. And you want it to start massaging so it feels like the tissues that aren't surgical. It is normal for the area to be a little tender after massage for, for 2 reasons. The first is you're trying a brand new technique. And even if it doesn't seem aggressive, if it's new to the surgical area, your area is going to feel like, oh, what's going on? We're starting to move in a way we've never moved. So yeah, it's going to be tender for maybe 24 hours after the technique. And the second time that you're really going to feel tenderness is when we are progressing to a more advanced or aggressive technique. Usually that means either deeper pressure longer hold or larger range of motion. And in both cases, it might be okay to feel that slight discomfort for 24 hours after. But if it's longer than 24 hours, yeah, you could be pressing too hard. The best person to ask is your women's health therapist. Not sure? Connect with me, send me a DM. Cupping is a fantastic advanced scar massage technique, and it does target the more superficial and slightly deeper fascial layers. You can have small cups and even larger and larger cups. Again, this is an advanced technique. It's not something you start with even if you're like, I'm like months or even years postpartum. If you've never done scar massage, don't start with this. It's pretty aggressive. It can definitely cause bruising, which may be a normal part of the treatment. But if done too aggressively, you will feel soreness for like 3 or 4 days afterwards. And, that may not necessarily even be a bad thing, except for the fact that you can't massage for those days then. It's quite irritating. The quick answer to this question is that you want to progress whatever scar massage technique that you're doing. And you do this in 3 different ways. You would take, for example, if you're doing this gentle pull and hold technique, you would move, firstly, closer and closer to the surgical area or the external scar. Secondly, you would increase the range of motion, meaning you would pull it harder and harder. And thirdly is the depth. So you would actually push in deep before you do the pull. And you can apply these 3 principles to basically any scar massage that you're doing. So you start actually creating 3 or 4 different techniques based on the one main technique. So for a little bit more information about that, download this free resource down below. It talks about how to progress your scar massage routine safely. You definitely want to follow your scar massage with an exercise. As a matter of fact, the way that I teach cesarean recovery is that you do 5 minutes every single day, a minimum of 5 minutes. And in those 5 minutes, you do 1 scar massage followed immediately by 1 movement or an exercise. Now, there are 4 categories of exercises that you want to consider. There's something to open up the front body, something that will strengthen your back body, something that will strengthen your front body in neutral, and something that will strengthen your body in bend and twist. So, if you're already following some kind of exercise routine, you could probably pick something that makes sense for you at your stage of healing. But it's very simple just to follow an exercise flow chart, a rehabilitation flow chart, and that is something that's included in all my programs. Each step of scar massage for your cesarean is listed in my flow chart, which is included in my cesarean recovery programs. Literally, you would just need to follow the flow chart. You start at the beginning. Doesn't matter if you're day 1 postpartum or year 10 postpartum, and you go through it. Obviously, every person is different, so every body needs a slightly bit more or less of certain things. But honestly, it is never too late to start. And the easiest way to go through it is just to follow a program. This is a program that starts at $69 a month if you're interested. But if you are early on in your recovery, you really want to enroll for the whole year. Major abdominal surgery isn't something that's done in 6 weeks. On average, a person takes 6 to 12 months to heal fully, to be returning to their activities and their exercises and sports. I'm trying something new today. Some of you may have remembered that I really hurt my back like 5 months ago now, pretty much. So I haven't been able to run very